This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Sometimes your body not feel so fine, head hanging low most of the time. Got that meat sack not doing good, head hanging low, don't feel like you should. I talk to the Carolyn. Talk to the Carolyn. Talk to the Carolyn. Talk to the Carolyn.
Welcome, everybody. We're live with Dr. Carolyn Dean here on AchieveRadio.com. Happy Monday evening or whatever day of the week you happen to find us if you're listening to the archives. And also welcome all of those who are listening in the United States as well as those who are listening around the world. We welcome everybody to join us tonight. We are so glad that you are here to be with us, not only for your own encouragement and your own enlightenment, but also to join us in hearing the wisdom of one of the truly most talented and absolutely terrific women in modern medicine these days, Dr. Carolyn Dean, holding a medical license from California and having a naturopathic education. But more than that, she's a visionary. She has the absolute vision, not just to be practicing for herself or building her own little practice in her own little corner of the world, or not just to be educating as a naturopath or a doctor, her little people in her community, but she has a vision for the world, and that vision for the world includes bringing people into a wholeness and a completeness that she is achieving through her formulas, and she is impacting the world. People from all over the United States as well as internationally. We ship to 215 countries, and her formulas are affecting everybody. And one of the things that she's also able to do is have a comprehensive awareness of what are the fundamental issues for health in the United States and around the world. And while different parts of the world have their different challenges, such as AIDS and the Zika virus and all these other things, you might be shocked to think that Dr. Dean would have the temerity to actually place magnesium deficiency in the same level with those kinds of unresolved issues. But in fact, she has, now calling magnesium deficiency one of America's and the world's secret public health crisis. And as we were talking about that and declaring that, I started to investigate and noticed myself that one of the biggest issues in the United States alone is the coming of age of the baby boomers that are turning 65 at a rate of 8,000 a day, and yes, living well into their 90s, yet Alzheimer's and heart disease are complicating their lives, and this is considered a public health issue. Yes, people, and what is at the root of Alzheimer's and health challenges and all the rest? Inflammatory issues that can be remedied through magnesium and mineral consumption. We're going to talk to Dr. Dean about that tonight, along with many other topics. Before I bring her on the show, let me just remind everybody that I said earlier, not only is she a medical doctor and a naturopath, she has an herbalist, an acupuncturist, a nutritionist. She's an intuitive. She's a lecturer. She's a consultant. She has been spoken about and spoken to in so many different media settings, and she's an author of over 30 books and 101 Kindles. We are so happy to have her with us this evening, and knowing that she's just getting started and going to have such a tremendous impact in 2017 with the release of the second edition of the Magnesium Miracle, wherein which she is making many of these declarations and bringing this information to the forefront. Welcome again this evening, Dr. Carolyn Dean.
Yes, and when the yay button is pressed, I press my unmute button, and I am ready to go. And that's a wonderful introduction for magnesium and for me. Thank you, Ginny. Ginny did a great blog today. I know she'll just say she cut and pasted from my new book, from the new edition of Magnesium Miracle 2017. We're getting very excited, Ginny and I and Chad, about the new edition. It's 200 pages longer than the other one, and I've updated every section. I mean, there isn't a page that I haven't had my hand in. And what Ginny did today with the blog, and you really have to go to it and follow along as I go through it, because it's one of the best ones, because she's listed the 65 magnesium deficiency conditions that I've identified over the years. I think in the first edition and then in a couple of reprints I had like 20, 21 conditions, but it's up to 65 now. And I think to get the whole unadulterated impact of what magnesium does, I'm just going to go through these conditions, and I'll get Ginny to interrupt me and ask more questions, but we'll spend our first half hour going through these conditions. And if at the end of it you don't say to yourself, well, gosh, I know at least a dozen people who have several of these conditions, I better tell them right now about REMAG. And it is about REMAG. That's what Bob is saying over and over again. I can't keep just saying magnesium is what's causing all these problems and magnesium is the cure, because it really is REMAG. If you take other forms of magnesium, especially the ones that are only 4% absorbed, you will not have the benefit. And I know many of you listening aren't using REMAG. People I talk to every day about this and that in the business world, they tell me, oh yeah, I'm taking 2,000 milligrams of magnesium. And I think, well, we don't measure our magnesium by the hundreds or thousands, and come to find out they're not even taking REMAG, still taking magnesiums that are only 4 to 20% absorbed. And we can be very clear and very adamant about this now, because we've had enough people say to us, look, just tell us what, that REMAG is the best, and we'll take it. We don't want to have to go through all these others. And that's exactly what I did in this 2017 edition of the Magnesium Miracle. I tell people to do Epsom salts, get them into magnesium, do REMAG, and if they want the effect that helps the bowels a little more, to do Natural Calm. Those are the only 3 magnesiums I talk about, because those are the ones that I do recommend. So with this blog, and Ginny starts out with magnesium deficiency is a public health crisis, growing in scope and proportion. I've identified 65 magnesium deficiency conditions, 100 factors that lead to magnesium deficiency, and 24 reasons why magnesium deficiency occurs. No government agency, university, health clinic, or doctor has come close to uncovering and documenting these facts. So, number 1, from A to Z, acid reflux, spasm of the lower esophageal sphincter at the juncture of the stomach can leave the sphincter open, kind of spasmed in an open position, causing acid reflux, GERD, or heartburn. Magnesium relieves esophageal spasms. I just had an email from a doctor who works with feeding disorders in children, and a lot of infants and children have acid reflux. They may have even types of vomiting, the worst being projectile vomiting. They're put on these proton pump inhibitors at this tender age to try to deal with this acid reflux. And what we know about proton pump inhibitors, the heartburn drugs, is they cause magnesium deficiency. So I don't know if they even help, but they certainly don't help if acid reflux is caused by magnesium deficiency. And looking through the literature, there are indications here and there that acid reflux can be caused by magnesium deficiency, but there are not enough studies. And, people don't go out of their way to do nutrient studies because no one's funding them. But what I say, especially to clinicians, is just start using it. Start trying it. Put the children in Epsom salt baths. Get them saturated with magnesium. Put Remag in their formula, and do your own clinical trial. Number 2, adrenal fatigue. Adrenal fatigue follows after a time of chronic stress, anxiety, and panic attacks, and it seems to be occurring in epidemic proportions. Adrenaline, noradrenaline, and cortisol are produced, elevated, etc., because of the chronic stress. Adrenaline, noradrenaline, they'll come out acutely. Cortisol is elevated chronically. And they all deplete magnesium. They need magnesium in order to make them. So you make these hormones, they're burnt off, and then away goes your magnesium. Stress causes the excess elimination of magnesium through the urine. You have stress, you just drop your magnesium. And that may be the reaction itself to these hormones, but that's the proof. Stress is such an overworked word, but we all suffer physical, emotional, and mental stress every day, and every bit of it drains magnesium. Number 3, Alzheimer's disease. Magnesium blocks the neuroinflammation caused by the inappropriate deposition of calcium and other heavy metals in brain cells. Magnesium is at work even before the inflammation begins, guarding cell ion channels and not allowing heavy metals to enter. Picometer stabilized ionic magnesium, Remag, easily enters cells and can help eliminate heavy metals and solubilized calcium. And that's huge. And we get reports from children whose parents are suffering Alzheimer's and senility, and they say their parents' health and brain function is improving just on Remag. And then that gets them excited enough to add all the other formulas. Angina. The pain of angina is caused by severe muscle spasms in heart muscles, which are caused by magnesium deficiency. I've said many times the highest level of magnesium in the whole body is in the heart. The heart ventricles have the highest levels of magnesium in the whole body. This is why magnesium is so important for the pumping function of the heart. Anxiety and panic attacks, this is pretty huge because it's the anxiety and panic attack that gets people started on the downward spiral of taking anti-anxiety medications, which are addictive, don't really cure the condition, they just suppress it. And with magnesium, what I say here is when the adrenals are no longer protected by sufficient magnesium, the fight-or-flight hormones, adrenaline, noradrenaline, become more easily triggered. When they surge erratically, they cause a rapid pulse, high blood pressure, and heart palpitations. The more magnesium deficient you are, the more exaggerated is the adrenaline response. Magnesium calms the nervous system, relaxes muscle tension, lowers the pulse rate, and helps to reduce anxiety and panic attacks. And I just should say there are some people with really low adrenals. They'll have low blood pressure, but often it starts with high blood pressure. I'm going to ask Ginny if she has any input at this point. I know she's busy multitasking with the chat line.
No, I think I'm glad you're doing this. I'm glad you're going down one by one. This is perfect. Nope, yep. I'm very happy.
Yeah, Ginny and I never plan anything. I never know what blog she's going to do. We just love to surprise one another. It keeps us on our toes. We'll never say, "Oh, you didn't warn me." We say, "Thank you for the challenge, young lady. Thank you."
That's right. That's right.
Number 6 is arthritis. I say in the book that I really kind of ignored arthritis in the first couple of printings of the book, but magnesium can help dissolve calcium that builds up in joint spaces. It can also treat the pain and inflammation of arthritis as a safe substitute for pain medication. Now, this is pretty huge. What we're saying is the calcium that dumps itself into soft tissues kind of around your low back, around in between the vertebrae, they just find a little home there. That calcium can be dissolved when you saturate yourself with magnesium. We're seeing this with people with the types of arthritis that put you in a wheelchair, ankylosing spondylitis, for Pete's sake. So this is a very important treatment of arthritis, this being REMAG. Asthma. Histamine production and bronchial spasms in the smooth muscles of the bronchial tract both increase simply as a result of magnesium deficiency. So, I mean, you can. This is why you can put yourself in a bit of an asthma attack or bronchial wheezing just by laughing. I used to do that, laugh so hard I'd start wheezing. That's because I used to have such bad magnesium deficiency. When I put a strain on my bronchial tract with all that laughing, the smooth muscles already tight because I didn't have enough magnesium to keep them relaxed, would just go into spasm. It's mechanical, it's physiologic, it's common sense what's happening. And yet by not addressing the magnesium deficiency of all these 65 conditions, we're doing a massive disservice to the public and the patients. We're giving them drugs. We're giving them drugs and asthma drugs. A lot of these inhalers have fluorine molecules in them, and the fluorine, when these drugs are broken down in the intestines by all these rampaging bacteria, the fluorine molecule is released. It will attach to magnesium and create brittle substances that find their way into the bones, causing arthritis, into the tendons, causing tendon rupture. So it is very important that we talk more and more about REMAG as treating these conditions, even preventatively, of course. Number 8, atherosclerosis and calcium deposits. Magnesium is necessary to help dissolve calcium and keep it soluble in the bloodstream. Magnesium, along with vitamin K2, helps direct calcium to the bones where it belongs. And the atherosclerosis, that's what we focus on. That's what they say the coronary arteries are blocked with, and peripheral circulation can be blocked by atherosclerosis. And modern medicine tries to blame everything on cholesterol. It's not true. The cholesterol can dump itself on top of the calcium. What starts it all off, I talk about this in the Magnesium Miracle book, is damaging of the sides of the arteries, especially when the arteries make little hairpin turns. But you can read about those technical things in the book. The long and short of it is, if you had enough magnesium, you would not be depositing calcium in and around this damaged area that's trying to be healed by the cholesterol. Cholesterol is not the bad guy. Statins end up being the bad guy when you're forced to take them by doctors who still think cholesterol is the cause of heart disease. Number 9, blood clots. Magnesium does not act like a blood-thinning drug. Instead, it prevents the calcium buildup that triggers clots. Magnesium naturally balances the blood clotting factors in the blood. Yeah, calcium again, when it's riding around unopposed by magnesium, can initiate clotting. And that's not something that is talked about, because meaning modern medicine, doesn't have drugs to block calcium. It does talk about calcium channel blockers for heart disease, but in that regard, magnesium is the best and the safest calcium channel blocker. Number 10, bowel disease. Magnesium deficiency slows down bowel peristalsis. That's the downward movement of the bowels that pushes our digested food forward. Way forward. If you don't have enough magnesium to keep the bowel muscles functioning properly, you get constipation. And that leads to toxicity as well as symptoms of colitis, IBS, diverticulitis, and Crohn's disease. Mix in yeast overgrowth with that, and you have those conditions. Number 11, brain function. And here I say you can obtain a free copy of the 355-page book called Magnesium in the Central Nervous System, put out 2011. It's online. You can just look up that word, magnesium in the central nervous system, and read you can read the whole book. I tell people to print it up, take it into your doctor. If you or your loved one is suffering from any sort of brain dysfunction, say, I need magnesium. Number 12, bruxism or teeth grinding. Up to 80% of cases of bruxism occur during sleep, and your dentist may be the first to notice that your teeth are being gradually worn down. Bruxism is related to clenching of the jaw muscles during the day and is usually associated with stress or anxiety. Any muscle tension can be the result of magnesium deficiency. Number 13, cholesterol elevation. And I talk about this a lot. When I was in medical school in the mid-70s, normal cholesterol levels were around 245 milligrams per deciliter. In the first edition of Magnesium Miracle, I reported allopathic medicine's normal value of cholesterol, 180 to 220. Now, a few years later, doctors are advising that cholesterol should be below 200 to be considered normal. What doctors don't seem to know is that magnesium bound to ATP is a controlling factor for the rate-limiting enzyme in cholesterol biosynthesis that is targeted by the statin drugs. And you can go to the blog at rnareset.com, click blog, and it's the blog of today, May 15th, 2017, and read that in more detail. So thus, magnesium is responsible for naturally slowing down the enzyme activity when cholesterol is present in sufficient quantities. So you got enough cholesterol, then magnesium will pull itself away from that enzyme, stop making cholesterol. So I repeat, this is the same enzyme that statin drugs target for destruction while creating a magnesium deficiency. Number 14 is chronic fatigue syndrome. I tell people I was in practice before chronic fatigue syndrome was even known. I mean, when it was first DISSED by modern medicine, they said it's just psychological. I have a chapter on chronic fatigue. It's remarkable how much magnesium, especially Remag, can help people get their energy back, get back on track by taking therapeutic magnesium. We still don't know what causes chronic fatigue syndrome, but in my discussion about the interaction between calcium and magnesium, I wonder if calcium excess and magnesium deficiency could be the underlying cause of mitochondrial dysfunction that many natural medicine practitioners say can trigger chronic fatigue syndrome and other chronic diseases. Now, what I say in the book, I mean, I do expand it in my radio shows and my e-books and all. I know chronic fatigue is part of the total body meltdown. It's part of the layering of poor diets, too much stress, not enough minerals, yeast overgrowth, the immune system being weakened by all the yeast toxins, and then having viral attacks, and then even being susceptible to Lyme disease. You take 100 people and expose them to Lyme. Not everybody will get Lyme. Why do people get Lyme disease? That's what we have to look at. So chronic fatigue syndrome and fibromyalgia, I say it's total body meltdown, get people on the minerals, some of the gentle detox of the Realign, do a yeast detox, and so much of the symptoms can be turned around. Number 15, cystitis, bladder infections. Magnesium deficiency causes bladder spasms, which can cause urinary frequency, often misinterpreted as a bladder infection. Magnesium deficiency can also allow calcium to build up in the lining of the bladder and urethra, causing irritation that mimics cystitis. We've had reports from elderly women who've thrown away their adult diapers because apparently Remag dissolves bladder tissue calcification and eliminates incontinence. Ginny, I'm going to check in with you again. How are you holding up there?
Nope, we're doing great. I'm following you perfectly. Yep, I'm very glad you're laying all this out. Excellent.
Thank you. Good. Number 16, depression. Serotonin, a neurotransmitter that elevates mood, depends on magnesium for its production and function, whether it's made in the brain or in the intestines. Dopamine, a neurotransmitter that helps control the brain's reward and pleasure centers, utilizes magnesium in several steps in its biochemical pathway. A magnesium-deficient brain is also more susceptible to allergens and foreign substances, which in some instances can cause symptoms similar to mental illness. In that bucket, I'd throw the aspartame, the artificial sweetener that is used excessively in our culture. Number 17, detoxification. Magnesium is crucial for the removal of toxic substances and heavy metals such as mercury, aluminum, and lead from the cells. Magnesium is a cofactor in both the production of glutathione and the function of the P450 detoxification systems in the liver. Now, in there, I could have put radiation. I don't know if I do talk about radiation in the 2017 edition, but there is some research out of Japan saying that magnesium does help protect the body from the effects of radiation. Diabetes, number 18. Magnesium is necessary to make and secrete insulin. It facilitates carbohydrate metabolism and allows insulin to transfer glucose into cells. Otherwise, glucose and insulin build up in the blood, causing various types of tissue damage. Tyrosine kinase, an enzyme that allows glucose entry into the cells along with insulin, is magnesium dependent. 7 of the 10 enzymes needed to metabolize glucose in the process called glycolysis are also magnesium dependent. This cycle functions in the cytosol, the watery component or compartment of the cell cytoplasm. This is huge. When you have all those activities that are required to help balance the blood sugar, the activities produced by magnesium. And maybe before I go further, I should just remind people that magnesium is important, necessary in the enzyme processes of 700 to 800 different enzymes in the body. And I just mentioned one here, the tyrosine kinase allows glucose entry into the cells. It's magnesium dependent, which means if there's not enough magnesium, that enzyme won't work. Same goes for 700 to 800 different enzyme systems in the body. Number 19, fatigue. Magnesium deficient patients commonly experience fatigue because dozens of enzyme systems are underfunctioning. The most important factor in energy production is ATP, which must be bound to a magnesium ion in order to be biologically active. ATP is produced in the Krebs cycle, which requires magnesium in 6 of its 8 steps. The Krebs cycle begins by using pyruvate from the glycolysis cycle and functions exclusively in the mitochondria. So if you've got mitochondria problems, look at your magnesium. And what did I just say about the glycolysis cycle? That was it 9 out of 10 steps, I have to go back there, require magnesium. So you've got each of these cycles cycling through the body. 7 of the 10 enzymes needed to metabolize glucose in glycolysis are magnesium dependent. So you can't, it's not like, oh, you need magnesium in 1 of the 10 steps or 2 or 3. 7 out of 10 means that it's just not going to function properly if you don't have magnesium. There's no other way to look at it. And just throwing into the mix here, the reason why doctors don't know this is we never learned it in medical school. Nobody learned it all the years before me, since me, and even today. They're not learning about magnesium in medical school. Number 20, headaches. Muscle tension and spasm in neck and head muscles can be alleviated with magnesium therapy, which can be applied locally and taken orally. 21, heart disease. The heart, specifically the left ventricle, has the highest amount of magnesium in the whole body. Magnesium deficiency is common in people with heart disease, and taking magnesium will reduce that risk. IV magnesium can prevent myocardial infarction, damage, and cardiac arrhythmia if given at the onset of a heart attack. Most drugs used in treating heart disease drain magnesium from the body. Now, we know from testimonials that people who've had to be on IV magnesium just to keep themselves from spasming away, they've been able to switch over to Remag because it's as effective, actually more effective than IV magnesium, because you can sip it through the day instead of getting a big shot of IV magnesium. Get a real magnesium high, and then over the next day or so, you drop back down again. It's quite a roller coaster. Number 22, hypertension. With insufficient magnesium and too much calcium, the smooth muscles lining blood vessels can go into spasm and cause high blood pressure. If cholesterol is elevated, which can also be due to magnesium deficiency, cholesterol can bind to calcium, causing atherosclerosis in the blood vessels, worsening high blood pressure. Number 23, hypoglycemia. Magnesium balances the release of insulin so that inappropriately large amounts aren't released, which could cause the blood sugar to drop suddenly, resulting in symptoms of low blood sugar. So it keeps insulin from shooting out in large quantities when you take that milkshake that has 27 teaspoons of sugar in it, or a can of soda with 10 teaspoons. Start reading your labels. A teaspoon of sugar is about 4 grams. So on a can of soda, if it says 40 grams, that's 10 teaspoons. You got to do the conversion. And at any one time in your bloodstream, you have about 4 teaspoons of sugar. So when you hit it with 10 teaspoons, all heck, everything goes crazy. Insulin starts flooding out. Oh my gosh, it's too much sugar. We got to get rid of it. And then when there's too much insulin, your blood sugar plummets. So that's why people keep getting a sugar high and then a sugar low and think that sugar's the treatment. It's not. 24, indigestion. The gastric proton pump that acidifies the contents of the stomach for proper digestion is dependent on magnesium. So even to keep your food digested properly, you require magnesium. 25, inflammation. Most drug companies are now embracing inflammation and not cholesterol as the cause of heart disease. They don't know what causes inflammation, or they say they don't. If they read their biochemistry, they would. Anyway, they don't know what causes inflammation, but that doesn't stop them from producing drugs to suppress it. They don't acknowledge that calcium is extremely pro-inflammatory and magnesium is very anti-inflammatory. The entire inflammatory cascade, and I list a bunch of them, escalates when magnesium is deficient. The bottom line is that inflammation is triggered by magnesium deficiency and relative calcium excess. 26, insomnia. Magnesium relieves the muscle tension that can prevent restful sleep. Also, sleep-regulating melatonin pathway production is disturbed without sufficient magnesium. Magnesium is so effective as a sleep aid that if someone is taking magnesium and their sleep is not improved, I say take more magnesium, or I should say take more Remag. And then I continue. You may have to take Remag to get the therapeutic effect without the laxative effect, and that's the brilliance of Remag. 27, irritable bowel syndrome. In my book, IBS for Dummies, I describe the importance of magnesium in the treatment of pain and spasm in IBS. 28, kidney disease. Magnesium deficiency contributes to atherosclerotic kidney failure because calcium builds up in the kidney arteries. They're also called the renal arteries, RENAL. Magnesium deficiency leads to abnormal lipid levels and worsening blood sugar control in kidney transplant patients. It's important for kidney patients to receive picometer stabilized ionic magnesium, Remag, that is absorbed directly into cells and therefore does not build up in the blood to cause electrolyte imbalance and rhythm disturbances. Because, and I say that in kidney disease where you can't clear magnesium from your bloodstream, they say that's a reason for people with kidney disease not to use magnesium. But if you use Remag and it just works directly inside the cells, it's not going to build up in the blood. 29, kidney stones. I have chapter 11 for evidence of magnesium's ability to prevent and treat kidney stones, especially when combined with its partner, vitamin B6. Now, if you just use Remag, you really don't even need B6, but we really do require the B vitamins, and therefore we have the group of methylated B vitamins in our Realign capsules. 30, migraine. Now, we talked about headaches, but migraines are different causation. Deficiency of serotonin can result in migraine, headaches, and depression. Serotonin depends on magnesium for proper balance. Also, tiny blood clots can block capillaries in the brain, leading to migraines. Magnesium prevents calcium from causing this excessive blood clotting. It's well known that IV and oral magnesium can treat and prevent migraine headaches. 31, musculoskeletal conditions. Insufficient magnesium and the relative excess of calcium will cause sustained muscle contraction in any muscle group in the body. The following musculoskeletal conditions are amenable to magnesium therapy. So I just list muscle cramps, fibrositis, fibromyalgia, GI spasms, tension, headaches, muscle spasms or contractions in any muscle of the body, chronic neck and back pain, and tension. Number 32, nerve problems, neuralgia, neuritis, neuropathies. Insufficient magnesium and the relative excess of calcium will cause sustained nerve excitation in any nerve cells in the body. Magnesium alleviates the following nerve disturbances that can occur: burning pain, muscle weakness, numbness, paralysis, pins and needles sensations, seizures and convulsions, skin sensitivity, tingling, twitching, vertigo, and confusion. I mean, that's huge. And what's happened in the muscle and nerve business of medicine is they keep inventing names of new conditions to describe what's basically spasming of muscles and nerves in various parts of the body. So anytime you hear, think about, or have a muscle or nerve problem, think of magnesium deficiency first. Number 33, obstetrical and gynecological problems. Magnesium helps prevent and treat the following: premenstrual syndrome, dysmenorrhea, which is cramping pain during menses, female infertility by relieving fallopian tube spasm, premature contractions, preeclampsia and eclampsia in pregnancy. That's the fluid retention, high blood pressure, and seizures that can occur due to magnesium deficiency, treated in the hospitals, have been for decades with intravenous magnesium, but doctors won't tell people to take magnesium as a preventive. Continuing on the OBGYN problems, cerebral palsy, sudden infant death syndrome, male infertility. Magnesium and zinc are present in significant quantities in healthy semen. So we have our Remag, and in Remite we have our zinc. that can help treat male infertility. 34, osteoporosis. Low magnesium in the presence of elevated calcium, with or without vitamin D, triggers a cascade of events leading to bone loss. 35, Parkinson's disease. Dopamine deficiency results in Parkinson's disease, and magnesium is a required cofactor in the production of dopamine. Magnesium also blocks the neuroinflammation caused by calcium deposits in the brain. 36, Raynaud's syndrome. Magnesium helps relax the spastic blood vessels that cause pain and numbness of the fingers. 37, sports injuries. Pain, inflammation, muscle spasm, muscle tension, and scarring can all be treated with magnesium. Sports recovery. Magnesium reduces lactic acid buildup and replaces magnesium sweat loss that can result in post-exercise pain. Temporomandibular joint syndrome, also called TMJ. This hinge joint connects the jawbone to the cheekbone. The joint can become irritated and inflamed due to arthritis, gum chewing, injury to the teeth or jaw, misalignment of the teeth or jaw, poor posture, stress, and teeth grinding. Most of these factors are aggravated by magnesium deficiency. 40, tongue biting. In a magnesium-deficient person, while eating, the muscles of the tongue and the muscles lining the inside of the mouth can go into spasm, causing the teeth to suddenly and inadvertently clamp down on the tongue, the side of the tongue usually, or the lining of the inside of the mouth. And you can get ulcers, mouth ulcers with that. And in people where that doesn't heal, it's a B vitamin deficiency and the need for probiotics, probably because there's yeast overgrowth. 41, tooth decay. Magnesium deficiency can cause an unhealthy balance of phosphorus and calcium in saliva, which damages the teeth. Now, I say it's 41, but you saw me jumping through a whole list of things, subheadings. So that's our 65. I didn't know if I'd get through it before the end of our whole show. But what happens is with all these conditions, since they're not looked upon as magnesium deficiency, they're treated with drugs. And Ginny goes on to say, in addition to uncovering these conditions and demonstrating the nature of magnesium deficiency within the condition, Dr. Dean has also amazingly, so I might add, discovered the solution to this crisis and put it within your grasp. The solution is called REMAG, a therapeutic, well-absorbed magnesium. And then she says, tonight we'll be talking about it. And I definitely have talked it to death, but I know Ginny's going to be happy to have this list for our customers, some of whom, they don't, they're not able to read what we say, and they love to hear things. Some people learn better when they hear. So anyway, that's our 65 conditions, and I'll go over to Ginny now and run and get myself some water.
I am glad you read that. And the other thing, Carolyn, is I think I would like you to just say a few words about what people think people think that they can treat some of these conditions with just, a half a teaspoon of REMAG or something. Can you talk about the therapeutic dosing and also the importance of REMITE?
Right. Yes, that was another important breakthrough, Ginny, is understanding the therapeutic levels of magnesium that are required. People have never had therapeutic levels of magnesium before because most of the magnesium products are so poorly absorbed they end up in the gut and they end up causing diarrhea. And on top of that, doctors are keen on telling people, well, when you get diarrhea, you've reached saturation. It's like your body's filled up to your nose, and anything more will come out the other end. And that's just not true. And I have another poster child experience with that because I cannot take any magnesiums except for REMAG without getting laxative effect. So I'd be spasming away, my heart palpitating, my leg cramps, et cetera, and have the laxative effect and be nowhere near therapeutic levels. I was having to take 4 teaspoons of Remag. So I don't like to say we're using medicinal amounts of magnesium, but maybe that will get it across to people that at a certain point in trying to build up your magnesium levels, you have to treat it like a medicine, and you just need more medicine in order to fill in the gaps that you've become deficient in. You have to have that extra amount, that reserve that you can call upon, and it's definitely something new in medicine to have therapeutic levels of certain nutrients. What else can I say about it?
Okay, how about this, Carol? Ginny, in her great intro, talked about you have a vision. One is limited to a vision as speculation if you don't have the answers. The reason you have a vision is you have the answers, and these things work. Then you can start thinking clearly about all kinds of other things because you got something to work. Nobody has anything to work, really, and so they're just making up theories. This is your vision is concrete.
Yeah. Yes. Yeah. That's a good explanation of why we are so adamant about being able to help people and being able to say that this works, because we see it over and over again. We're in an ongoing experiment in a sense. We're doing our own clinical research here and proving over and over again that magnesium can treat all these conditions, and reflexly we have to say, well, it's treating because these conditions are caused by magnesium deficiency, and it's horrendous. You know, if you just stop and think for a moment about these 65, and there's many more conditions I haven't even mentioned. Think about these conditions that are being overlooked as to their cause and their very simple treatment.
Do you realize, people, when you have something that works, you realize how happy that makes you? We're delirious over here in Maui. We actually there's nobody else in the world who's got something that works. Now, maybe Carol will make more discoveries and something will even work better. But we are the only solution for your magnesium issue. That's why the book is badly titled. It's the Remag Miracle, not the Magnesium Miracle.
Okay, back to Ginny. We got to move on, Bob.
I just wanted to also say that we're in another awkward position because we very clearly have to manage our supplement products as retail products, so to speak, even though we have a doctor-created, doctor-recommended, and doctor-overseen, doctor-supported brand. No other magnesium product can say that. And you are a doctor, and it's funny because you've written a protocol, which to me is one step away from a prescription. And if our customer segment is anything close to representative to the traditional segment of people using prescription drugs, I can see why some people have problems with prescription drugs because they don't follow the directions. And you've written a protocol that is a very specific direction for how to use a therapeutic form of magnesium they've never encountered before. And, of course, we have customers who've been, they've been around the block a million times and think they know everything there is to know about supplements, or they've been in natural remedies and all the rest of this for a long time, and so they don't really yield to what you've recommended. And they do not follow the protocol, which is very clearly to start with a quarter teaspoon in a quart of water, to sip that water throughout the day, and to build the dose in that same quart of water by adding a quarter teaspoon every 2 or 3 days until they get to the optimal therapeutic dose of 2 teaspoons in their quart of water. And they make all kinds of modifications and then they wonder kind of why it's not necessarily working the way they want it to. But really, or they'll write and they say, I have 15 of these different conditions and I'm taking a quarter teaspoon. And we're all about people starting low and slow, but really we do want people to follow the protocol, but yet we can't really say it's a prescription that's been written by a doctor, because then it makes it seem like we've got a medical program here and the FDA is going to frown on that and intervene and all the rest, and we don't want to draw attention to it that way. But that is really kind of what we have going on. Do you think that's accurate?
Yes, and that's a good point, because on our labels we cannot act like we're prescribing, just as Ginny said. And on the label, I wanted to be very clear that this was not a high-dose magnesium, because that's where the FDA will eventually come down on supplements that are high-dose, that are above the RDA. And you'll see that coming down the pike. So that's why I say the dosage is a half a teaspoon twice a day, which is only 300 milligrams. But then I do sneak it in there that for therapeutic amounts or higher amounts, consult with your doctor or whatever. And we do say to start with a quarter teaspoon. And I think we're going to take out the sentence that says, but if you're a veteran magnesium user, you can start with half a teaspoon. And some people think, oh, yeah, I'm a veteran user, I could take 2 teaspoons a day. And then they get their 700-800 enzyme systems all revved up, and then they say, what's wrong with your magnesium that it's revved me up? And it's not that. It's just the system, the body systems that are motivated to work better, but by giving them good therapeutic magnesium, just start revving your body up. And in some cases, I say to people, you're just not used to feeling energy, or getting your energy back, or getting stirred up. Now, the same thing does not happen with Remite. Remite is our 12 minerals. It is very low potency. I made it very, very low potency because I did not want people to take a lot of all these minerals, having 12 together. I wanted them all to be compatible and balanced out, very low copper because of all the copper toxicity, and higher zinc. So it's very well thought out, as well as the dosage. We try to keep people just at 1.5 teaspoons to 2 teaspoons. Certainly if you're on 3 to 4 teaspoons of Remag, you'd want to be on the 2 teaspoons of Remite. But they go together. They're just, so hand in hand. However, the reason why we really focus on Remag, I'd say over and over, it's those 700, 800 different enzyme systems. When I was, following Ginny's lead about magnesium deficiency is the new scurvy, I looked up vitamin C, and it's responsible for 8 enzyme systems. Magnesium is responsible for 800. So it is going to be, far more, enthusiastic in your body when you start taking it. A lot is going to get triggered. Zinc, I think, might have 180 enzyme systems. So zinc is very important. But again, not high-dose zinc. You don't read about a mineral and say, oh, I'm just going to take a ton of that. You've got to realize that there's got to be a balance, and that's why even when people say, well, I have this hair mineral analysis, and it says I'm low in these 2 things, I want to take a lot of them. No, that's going to flip you into being too high in them and push down other ones. I think, and, I'm not a hair mineral analysis expert by any means, but I certainly studied it in naturopathic school, and I just shied away from it because it's impossible to read those things with any accuracy because there's so many variables. And I just say to people, look, you can do a hair mineral analysis and just, hold that on the side and take your Remite along with your Remag and your sea salted water, repeat your test in 4 or 6 months, and you'll see it improves, without all this thinking that, oh, well, my brain is smarter than my body, and I'm going to tell it what to do. And you know what? With inferior minerals that aren't even absorbed, we're interfering so much in the body and not allowing our common sense to just say, okay, let's just go slow, eat a good diet, exercise, have a good attitude, take the total body reset products, and I'll be just fine. That's all you have to do. We're making it real simple for you.
Our good friend Judy, I think it's Judy B, typed in, Carolyn, why don't they teach this in medical school? And I said they should call them prescription schools, because maybe it would be more clear and reflective of what's really going on. I'm going to study prescription medicine, is what they really should say. Right? And then everybody would be getting it, be like, oh, yeah, well, why would we be teaching about something natural in prescription school? All right, everybody, listen, Dr. Dean. Yeah, go ahead.
Go ahead. No, we're done.
Dr. Dean's just getting started. We've got hour 2 rolling out here in just a minute. As soon as we take a break, she's going to wet her whistle with some of her own Remite water, and we'll be right back with Ginny and Dr. Dean. And, of course, I'm sure Bob will be chiming in as well. We'll be right back, everybody. Hang in there.
You can also get updates and resources online by visiting drcarolyndean.com.
AchieveRadio.com.
You change your body, cellular structure. You provide your body with new information. They call that RNA.
Okay.
And it affects your DNA, and it gives new information to the cells of your body, and so they replicate perfectly as they did when you knew you were God. Your blood will change. Your blood type will change. Your meat sac body will change, shift, and perfectly so, as a God. See, they talk about gods can be in whatever image they want to be. Even in the top 10, it says you shall worship no graven images. Well, what y'all got now are graven. You don't have complete cells. And that's why we say ascension is a 3-part process. And, honey, you've heard that till you're blue.
Yes. Yes,
well, this
I have.
is the second part of the 3-part process.
Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Sometimes your body not feel so fine, head hanging low most of the time. Got that meat sack not doing good, head hanging low, don't feel like you should. I talk to the Carolyn. What? Talk to the Carolyn. Talk to the Carolyn. What? Talk to the Carolyn.
Welcome back, everybody, live with Dr. Carolyn Dean here on Monday evening, March, 15th or something like that. Sometime in March 2017. We're sailing along. We're happy to have you with us.
It's not March.
It's May. It's May. It's May. May, Mother's Day. My goodness, how could I have missed it? I don't know, everybody. Oh, thank goodness there's no time. I can't have that egregious air counted against me. Welcome back, everybody. It's May, and you're here with Dr. Carolyn Dean live, and we're so happy to have you. And we've got lots of callers on the line who want to talk to Dr. Dean. Thank you for calling in this evening, and we are going to go to our phone calls. Let me also just say 602-666-6027 is the phone number. For those who do want to call and talk to Dr. Dean, we'd be happy to have you discuss your concerns with her. I'm going to call you out by your area code, and then when I put you on the line, just please give us your name and state your question or comment. We also have our mailbag segment this evening as well, so we'll be answering those mailbag questions in hour 2 as well. So, Carolyn, you ready to take some phone calls?
I am. I'm quite ready.
All right, very good. We'll go to area code 512, the great state of Austin, Texas. You're on the line with Dr. Dean.
Why did you get a training plate?
Hello, area code 5012. Are you there?
I think it's because you said the great state of Austin, Texas.
Is that what I said? All right. We're going to let me gain my composure. We'll come back to the great state of Austin, Texas. Let's go on to the next great state of Florida. Area code 321, you're on the line with Dr. Dean.
Hello?
Hello?
Hi.
Go ahead,
You're
please.
on. What's your first name?
Good evening. My name is Lori.
Okay, Lori, this is Carolyn. Go ahead.
Yes. My husband has a sequestered fragment. And I was wondering, first of all, I don't know if you know what that is.
No, sequestered fragment of what and where?
Okay, so it's in his lumbars. So the dura tore and part of the disc squeezed through the dura, and this piece of the not the disc of the disc, not the vertebrae, but the disc itself seeped through the dura into the root canal. Excruciating pain, and that's been a couple of years, and it's getting better. I do a lot of nerve work on him, but I'm wondering if the magnesium could actually dissolve that fragment.
Well, it could certainly help with the pain and the inflammation and any swelling. It would depend on the size of the fragment. Have they been able to image that?
Yes, in an MRI. I don't know how big it is actually, but I thought that the body could eventually dissolve it, and perhaps I was hoping that maybe the magnesium.
And it's quite possible. I know that magnesium, especially the Remag type of magnesium, does find its way into the cerebral spinal fluid. So that would be what we would imagine happening, is saturating the body with magnesium, it getting into the cerebrospinal fluid and around that those nerve roots, and then and dissolving the calcium. So it's a bone fragment from the vertebrae that kind of found its way through the covering of the nerves or the whole spinal cord.
No, it's not the bone fragment. No, it's not the bone. It's the disc in between the vertebrae that's kind of like a hangnail that seeped through the door and hanging in the root canal.
Okay.
From an impact.
The disc, from an impact. Okay. So we have to look at then what the vertebral disc is made of. And it's been 4 years, you said?
5 years, actually.
Okay, because it's a disc it's not like let me see if I remember what I had learned in medical school. It's let's look what it's made of. A gel-like center, each disc forms a fibrocartilage. So, that should be dissolving. I wonder why it's still there.
It's better. He can actually spread his feet, wide now, and he could walk a decent distance. So he can't lift up anything more than 20 pounds, because then compression seems to disrupt that. So
push on the area, right?
Yep. Yes.
Well, it's when you have a horrific pain like that, it's pretty hard to kind of undo the pain, because it's all what there is this whole protection around a painful area of all the muscles get involved and tendons and ligaments, and they all get tight to try to protect the area. So at a certain point, everything is just painful. So what I'm thinking, I mean, the discs are made of this type of gel. I'm just trying to see. Have a note here. In scoliosis, you can have calcium deposits in the cartilage end plate and sometimes in the disc itself. So, I mean, that the discs shouldn't have anything hard like calcium in them. So the saturation with Remag still stands because you want the whole area to be relaxed, lose the inflammation, lose the spasm, and hopefully, if there's anything that the magnesium can do to the disc substance. But yeah, if they image something, it's got to be something solid. A gel won't, you really don't see discs under X-ray because they don't have enough solid stuff in order to block the X-ray image. You know what I'm saying?
Correct. Yes, I do. Mm-hmm.
Yeah. So, well, we would just say to definitely use the Remag. Make sure he's hydrated. The way we talk about, take half the body weight and make that in ounces of water. 200 pounds,
yes.
And you want 100 ounces of water, and put sea salt in there, a quarter teaspoon for every quart, because the hydration, well, you're probably an expert in this now. The discs need to be hydrated.
Correct. Mm-hmm.
So, yeah. Do you have any other questions? I mean, what do you think about? You're obviously thinking about using magnesium. What are your thoughts?
Well, I use it, and I recommend it to many of my clients. Have bought from it from you, and they have gotten amazing results, and myself included. So he was a little resistant. He didn't like the taste, and men sometimes. Right. So I figured if I got him to listen to this, he would perhaps, try it despite his taste.
Right. Well,
and if anything changes.
Yeah, if you listen to the first hour, magnesium does so much. I mean, who knows what other things will be helped, but I know I keep teasing people with the thought that we are coming up with a Remag capsule. It's just so hydrophilic, it pulls water into the capsule, so we have to get around that. But eventually you can look forward to a capsule. In the meantime, if you put that 1 teaspoon in a quart of water and drink that quart of water, you don't taste it. If you just put it in a couple of ounces, you're going to taste it because it's so concentrated. But the concentration is what makes it work.
Yes, I will do that. I'm not going to put the Remite in. I put the Remite and the Remag in the water, and he couldn't stand the taste. I like it. So I'll just maybe do it separate a little. Yeah. All right, well, if anything really occurs, anything interesting, I'll be sure to let you guys know. Just another little number 66.
Yeah. I mean, well, thanks for calling, and you've got a lot on your hands there, and but you sound like he's doing better, and you're coping with it, so that's good.
Yeah, thank you so much. I enjoy your work and who you are and your products, and thank you so much.
Thank you, Laura. Take care now. Lori, yeah, thank you. Bye-bye.
You're welcome. Bye-bye.
Okay, excellent. Let's go back to area code 512.
Hello?
Hello? Yes.
Hello?
Are you available to talk to Dr. Dean, area code 512? That's you?
Yes, I am.
Go ahead, please.
Okay, so I've been on the Remag and the Remite for maybe 5 weeks now. Mm-hmm. And I'm taking it to help with heart palpitations and adrenal fatigue. I also got off of a benzodiazepine type medication 2 years ago. A little over 2 years ago was when I finished my taper. So I was starting to feel more energy and feel better on the Remag and Remite. But the last, I don't know if maybe I did too much exercise or did too much. I started having enough energy to get out of the house every day. And then this past week, I've been very fatigued, still on the same dose. I've worked up very slowly because I read your article on what to do if you feel worse, to work up slowly if you have adrenal issues. And so I've been working up very slowly. I'm up to 1 teaspoon. So I'm just adding maybe like every 4 or 5 days I'll add. So I don't know if I'm going way too slow or if that's even too fast.
Right. What's your first name?
Jennifer.
Jennifer. Thanks, Jennifer. How old are you?
I'm 46.
46. Still a young thing. Well, yeah, it's the dance that we have with the especially the Remag. It strikes me that you're at the point where you do have to up it. It's like you've opened up all your enzyme systems, and they want more. You may have done too much, like you say, getting out more than you ever had before. That's possible. So personally, I would even go up half a teaspoon, or do the quarter teaspoon, and increase every 2 days instead of every 4 to 5, because it's like, you've proven that your body needs it and it does better on it. You're not at a therapeutic dose, which, can be 2 to 3, even 4 teaspoons. You might do well on 2.5 to 3 teaspoons. So that would be my my personal recommendation for myself on what little you've told me so far. What do you think?
Yeah, I do think that. I would like to. I just, I have that little fear just because, of going too fast because of, reading the article that you don't want to push your adrenals too hard. So I have that fear, but I do want to get up higher and see what happens. But I just don't, I don't know if that's going to cause.
Well, all you do then, you can just stay at the rate you've been going, but just rest more. Look at my blog called Lying Down Therapy, where maybe your body, instead of using the magnesium to go out and do more like you would want to, but that may be exhausting you. Instead of doing that, just rest for the week and say, okay, I did too much. If I want to keep going slowly, because what you're expressing is, it's a true concern that if you do too much and start to revenue up too much, you don't want to have to say, oh, now I have to cut back. You don't want to do this bouncing back and forth. You want a slow, gradual increase, and you don't want to have to say, oh, now I took too much, now I have to cut back. And you know what I'm saying? It's best to just slowly keep going.
Yeah, because I never felt like I was revving up too much, and I never felt. I never had too many detox systems. So I guess my question is, like, when you say, make sure you go slow, like, how do you know what would I feel if I was going too fast? Would I feel detox things like headache, nausea, and so forth, or would it just be too hyper?
It can be both. It can be either. It's usually not both at the same time, but I think you're past the stage where your body is going to, react to it, being at the 1 teaspoon dose. But again, you've always got to listen to your intuition and your gut on this. And if you were, so you've just got, I know you could do it faster, but your brain is concerned. So your brain rules. You cannot say, well, I'm going to do it. Dr. Dean said I could. And I don't want that to be the case. I want you to say, no, my brain's telling me to slow down. There's no downside to keeping it, keep going slow.
Okay, yeah. Well, what about as far as the detoxing, like the heavy metals and so forth? I mean, how long does that process take? Months? I mean, if my body is truly finally getting rid of some stuff, I mean, is it just going to keep on going?
It's getting rid of stuff right now. It's ongoing. You're going to be on Remag. You know, that's your food. So it's going to be long term. So you're just going to say to yourself, you know, I'm detoxing, but I'm not suffering any Herxheimer, and I'm happy for that. So as it's working on, you know, your 700-800 enzyme systems, it's going into the liver and helping to detox. It's helping your glutathione. So it's working behind the scenes. You're doing exactly the right thing because we want people to hit that, you know, nice sweet spot between, you know, feeling better and feeling worse with detox. So you've been feeling better, and the fatigue is only natural because your body wants more magnesium. You're using it up with doing more activity. That's all.
I do think I have experienced some sort of Herxheimer. Well, maybe, I'm not sure, but I have these days when I just like run to the bathroom like over and over. I'm, you know, it seems like I'm peeing out every time I drink the water or the, you know, the Remag and the minerals in the water. I'm peeing it out immediately, and I'll be maybe going to the bathroom every hour. I mean, just ridiculous. And so is that maybe a sign of purging things, or is that still just the magnesium deficiency causing the, you know, the...
That's a good question. I mean, as long as it's not diarrhea, I was, you know, when you said running to the bathroom, if it's urination, yeah, it can. What did you have fluid retention? Did you have edema around your?
Yeah, when I got off the it was a diazepam, which is like Valium basically. When I got off of that, that's when that started with the fluid retention in my calves. So I would puff up during the day, and then I would all night long be running, you know, getting up in the middle of the night, maybe 3 or 4 times, and then in the morning my calves would be back to being real skinny. And I've never had that until I got off that drug. So I know it's something, it threw my body off into some, you know, fluid retention and then getting rid of it. It's like this cycle my body's been on for 2 years now.
Right. Okay.
Yeah.
Well, that's what will start to get balanced off. The fluid retention is something that people will say when they start getting balanced on their minerals, not just the Remag, but the Remite and the sea salt water. Then they start keeping their the water that's needed to work with the minerals inside the cells and not creating edema. So that'll balance itself out. It's as you said, it's only been 5 weeks and you've been slowly building up. So that's going to take time, but that definitely will shift. But your body's just, continuing to dump the fluid right now.
Yeah, I still have some of those days. They seem to be less frequent, but I do have those days, and sometimes I'm like, oh my gosh, why am my body's dehydrating itself? Like I can't hold on to water.
No, and right, and you've got to think it's been years that I've been magnesium deficient, and I'm starting to see positive signs, and I'm very happy for that. And try not to focus on the stuff that's left. You have to know that you're on the right path, which it sounds like you are.
I hope so. Well, can I ask you your opinion on adrenal supplementation? Do you feel that the glandulars are a good idea or not such a good idea? Because I'm trying to not take them, but some days I feel like I need them.
But I don't want them before.
I was on them daily, and I weaned off those as well because I read some stuff that scared me about those as well. And so now, every now and then when I'm having a really bad slump day and I have to get up and take the kids places, I'll take one, like just one pill.
I think that's okay. What happens because when the adrenals are fatigued and they really require the minerals and the sodium and the sea salt and everything, and people get on the glandulars, you can get, I don't know, addicted may be the word. You get dependent.
Yeah.
That's the
word. Definitely.
You get dependent on them. But if you use them like you are, one or two, a day or two a week while you're building up your adrenals, I think that's okay, especially if you see it's helping you. But again, it all takes time, and it's difficult, being a mom and having to, be present all the time for your kids. And what I'd like you to do, Jennifer, is maybe, the tone you have about what's going on. You're early in the process, but, maybe you could call up customer service, because when I said, whatever I said, and you said, I hope so, I hope I'm getting better, we want you to be, a lot more confident about your doing, and I want to know why you're not, what you think is holding you back. And I don't know if on the show is the place to do that. So will you do that? Phone up Ginny tomorrow and just get it clear with her what you think you might be missing?
Yes, I would love that. Yes, that sounds good.
Yeah, I think that's the next step. And you're in the early stages, but we don't want you to feel that this isn't normal. I mean, you're kind of in the normal process, and we don't want you to feel you're not doing well, because you are doing extremely well from what I'm hearing. But it means when people have this concern about, you've expressed it a couple times, afraid of going too fast, afraid of going too slow. So there's something more that we need to support you on. Okay?
Okay, that sounds great.
Okay, good. Okay,
thank you.
So we'll let you go now, and Ginny can expect your call tomorrow, okay?
Okay, I will.
Okay, great.
All
okay,
right.
Jennifer, bye-bye.
Very good.
Thank you. Thank you, Dr. Dean. Bye.
Bye-bye.
Okay, very good. 602-666-6027 is the phone number. We've got several more phone calls, and then we've got to get to our mailbag, Carolyn. So let's go to area code 815. Out to 815. You're on the line with Dr. Dean this evening. If you could give us your name and then state your question or comment.
This is Paulette, and I'm also
Hi,
trying to find that. Hi, I'm trying to find that sweet spot of how much Remag, Remite, and Recalcia. I tried going a little over two teaspoons of Remag, a teaspoon of Remite, and a teaspoon of Recalcia. And other than the taste, which I find really awful, I'm not sure which one does it, today's the first day I haven't had the laxative effect on that amount. So is that where I should stay for a while, or go up slowly to 3 and 2?
No, I'd stay there. Stay there for a while, definitely, especially if you've been, kind of trying to teetering back and forth. I'd stay there for, a week or two, and then see what symptoms are leaving, see what symptoms are remaining, and then see if you should increase. And did you get our FAQ on using psyllium seed powder to help stabilize the bowels?
I did sort of vaguely remember hearing something about that, but I can look it up. Not real fond of psyllium seed, so I haven't used it, but it seems to have leveled itself out.
Right, but that's your fallback position. Psyllium, you can, I don't know.
So if you do notice you're starting to get some laxative effect, just add a little psyllium to your diet, not necessarily to the water.
Correct, to your diet. I mean, I have mild IBS, so I just take it, and with my yeast overgrowth history, every morning I just take a tablespoon of psyllium and bentonite. But in in the bentonite clay, I put a couple of drops of, peppermint, an essential oil. So it tastes kind of like a mint drink that I'm drinking. And what you do with your psyllium is you just shake it up in about 4 ounces of water real fast, drink it down real fast so it doesn't turn into that ridiculous gel. And that makes it that makes it a little less horrible. But it is a bulker that some people require.
I've used it before. Sometimes I put in the restructure. I'll put it in the blender and then use some the gelling seeds. What are those things?
Oh yeah, the chia seeds.
Chia seeds. I use little chia seeds, and that sort of has that sort of effect too.
Yeah.
And it thickens it up nicely. And do you have any plans to make chocolate?
No, we're not in the business to sell products,
my own chocolate.
And we just tell people, get your raw cacao powder and just put in a tablespoon of that, and I think people are doing that and feeling happy with it. I was really excited today because I wanted some plain yogurt, and I had some strawberries to put in. And I thought, I'll put in some restructure. So I put in like 3/4 of scoop and mixed it in the yogurt, and it made it taste delicious. Like I had like vanilla yogurt with a nice, really nice taste. So there's lots you can do.
I also add vanilla that I got in Mexico, and that makes it it adds something nice to it too. But the unsweetened coconut, which is kind of tasteless. All right, so, that's what I needed to know.
Yeah, and you called in the day when you were starting to get better, but now you have more reinforcement about either more chia seeds or using the psyllium seed powder. Okay.
Well, I hadn't thought about it, but somebody else said they got kind of jittery or hyper, and I thought it was just because I was so sensitive to caffeine because I was real jittery and hyper last week. But that seems to have gone away too. I typically don't overdo
that could have been getting revving up. What week are you on with the products?
About 6. I had a terrible migraine last week, which was why I went ahead and had some coffee, hoping that it would help the migraine. But it did eventually go away.
Right, and with the Remag, hopefully that's going to stop the migraines. And are you on the Realign as well for the?
I've gotten rid of the bruxism. I've gotten rid of the terrible 45-minute to an hour leg cramps at night. So I'm pleased. I'm just impatient. That's all.
Oh yeah, that's kind of a human. It's in our genes. It's in our genes to be impatient.
And I'm recommending it to any patient who will listen. Some listen, some don't.
Yeah, oh, good. Well, the migraines are interesting because we've had people say that they'll give a teaspoon to a friend who has a migraine, a whole teaspoon all at once, with no build-up. And it'll help. So we know as you get higher, or when you, heaven forbid, if you get another migraine, hopefully it just keeps them away. But if you get another migraine, then take more Remag, even in the middle of
I never even thought of that. And also, since I work in a hospital, I don't take the Remag with me. I leave it at home. I just take my sea salted water with me. But maybe I'll find a small bottle and put some in there.
Yeah, put your Remag right in your water. Or, if you need
I do that. And then I take the sea salted water with me.
Gotcha.
The sea salted Remag, Remite, and Recalcia water.
Got it, yeah. So, take a little extra.
Or kombucha or whatever I'm putting it in, because I'm not fond of the taste.
No, and we expect that people will be very happy to have the capsules. But we're going to keep using the liquid because it really helps people to wean into the formulas because it
makes sense. It's going to be directly absorbed.
Yes. Oh, yes. It's just.
Does this mean anything? Because sometimes on the same day, I would think this stuff tastes dreadful, and then an hour or two later, I would be just sucking it up because it tasted wonderful. Does that mean anything, or is it?
Well,
I was thinking, well, maybe my
if...
level was down, and that's when it tasted wonderful, and later in the day it tasted terrible because it wasn't as low.
I think it's got to do with most detox. I think it's got to do with maybe you're detoxing from the mouth, so that there's like a bitterness that is in the mouth anyway that's exacerbated by the drink. But all these questions are, and reactions are very interesting, and we're trying to keep track of them to figure out what's going on because, as we keep saying, this is the first time people have been able to take therapeutic levels of magnesium because it's so well absorbed.
That is interesting. I never thought of that. I just don't know why 1 minute it would taste fine and an hour later it'd be, oh, God, this is the grossest stuff ever. And then a couple hours later it would task good again. Right. And I shake it because I'm thinking, well, maybe it settled or something.
Oh, right. No. The naturopaths use what's called a zinc taste test. They give people a
I've
liquid
had it.
zinc.
The first time I had it, I couldn't taste it at all after 10 minutes even. And my alphas was 19. So I know I was very deficient in zinc.
Very deficient, yeah. But I don't know if that's the same for magnesium. It's one of the things that we're, kind of looking into.
And I figured that I wouldn't spend my $50 on the test because I would just wait until I got rid of the leg cramps. So maybe I'll go get
I've never had a test. Maybe I shouldn't admit to that, but my heart palpitations and leg cramps, okay, I'm deficient. I take my magnesium, it goes away. Okay, I'm getting saturated. I mean, to me, it's just an obvious clinical experiment, whereas the blood test can be inaccurate, especially if you can't get the ionized magnesium test.
Well, I've ordered it on my patients, and the lab automatically cancels it and orders the serum. It's very aggravating. They think I made a mistake when I entered it.
Yeah. Oh, that's so sad.
Yeah.
Well, I'm
but
glad
I tell
you're
people who
using
have the leg cramps, this is your lab test.
Yeah. Yeah.
All righty. I appreciate it. Enjoy.
Oh, thanks for calling in. Thanks for recommending magnesium. That's fantastic.
Oh, I don't recommend magnesium. I recommend Remag.
Hey, I waited for you to say that. Good for you.
But Jenny set us up earlier. All right.
Yeah,
thank you.
That's right.
All right.
Okay,
Bye-bye.
keep us posted. Thank you for calling in. Bye-bye.
Right, bye-bye.
All right, excellent. Moving along. Thank you so much. A wonderful phone call. Always good to get this information for everybody listening. Let's go out to Connecticut. I think this is Sandy. Is this you, Sandy?
Yes, it is. Hello, how are you?
Hi, love. Good. How are you?
Well, I want to tell you, it's been a year a year and just a couple of weeks, that Saturday when you called me and I was in pieces and had, boy, did I fall under the water. And that was awful. It's been a year.
Wow.
I can't tell you how I got my life back. I'm starting to drive. I'm driving again. I'm mopping up the little bits that are still left over. I still haven't been on it, it a little bit longer, and I'm going to be absolutely fantastic. I'm never going to stop taking this. It's the support team that I got. Incredible. I think people just need to hang in there. Just hang in there. Take the Cilium or Metamucil or whatever they want to take. To hang in there. Take the stuff. I'm telling you, the turnabout when it finally hits. I think I know what you're talking about. Because all of a sudden, even my husband said, "Wow, suddenly you're doing a lot more." Well, I'm feeling a lot better. So I'm telling you, incredible. Oh, and that woman that called in, she said that her husband didn't want to drink it because he didn't like the taste. Well, how about this? You know, I know that Crystal Light isn't what we're all saying she should use, but you know they have these little packets that are like that, and you rip them open, you put them in a bottle of water, and it makes the water taste like strawberries or whatever it's supposed to taste like. And yes, it isn't. You know, it isn't 100% natural, but they do have ones that are based on a more natural.
Stevia. The stevia.
Yeah.
Yeah, that's a good idea.
At least this is someone who you're trying to get it into. It's you know, basically most people are like me. We're just drinking it. I don't even taste it anymore. But other people who are, a lot of people, I don't care. I can taste it. I can't drink it. Well, how about if she even mixed it up with some apple juice? You know, I mean, does it necessarily have to be just water, you know, just to get it into the guy, just to get him to, and then slowly put water, less apple juice, water, less, and before you know it, he won't hardly taste it at all. Or he can get that, maybe that's another thing you can come out with, is something that they can tear open. It's a little taste thing that, you know, just sweetens it up.
I know
so that
Ginny probably has in customer service, I'm sure they have a FAQ telling people, you know, a list of things they can do to make it more palatable. And people do come up with all kinds of great ideas. But, yeah, sometimes it's hard, you know, getting the husband on board, even though, I mean, it's really going to help him when he does. But, yeah, you know, Sandy's a cook and a baker, so she's all about doing this sort of thing, right?
Well, you know, that brings me to my question. My question is, can we take the magnesium and the Remag, maybe even a little bit of the Recalcia, can that be put in boiling water or any kind of boiling substance? Does it change the substance at all when it's boiled? Does boiling hurt it?
I don't like boiling for the magnesium because it tends to be a volatile mineral. It's used in fireworks. You know, you set a match to it and it blows up, and so that means it might dissipate in the steam. But you know, when I've said that, I don't. So I tell people to watch that with the Remag. But then the natural calm people, they've been telling people to put their magnesium citrate powder in boiled water, and make it like a tea. So
I've heard of that. Now, how about this? Now, if you were going, just say someone was inclined to make a mixture on the stove, and they're kind of boiling down their blueberry mixture, say, and they're making it into a syrup. Now, from what you just told me, I'm thinking, okay, instead of adding it at that point, then to get it mixed real good, because you wouldn't want just do it when let the stuff cool down. Then add the ingredients. Okay, all right. That clears that up in my head. It completely. Just completely. Yeah, that's great. That's great. I'm working on one more recipe, and it should be perfected soon. I'm going to be sending it to Jenny very shortly. Well, that was all I had to say was look at me. When first time I spoke to you, I was full of anxiety. My goodness me, I was thinking that I'd rather die than live like that. And I could see how even before that amoxicillin, I did have, those little symptoms, and the doctors never saw it. You're right. They never saw it until finally, I had the total body breakdown thing. Well, I'll let
Sandy,
you off the phone.
Sandy.
Yeah.
That's your name, right?
Yeah.
Sandy? Yeah.
This is Bob. Hello,
we got a revolution
Bob.
going on. Hello, Sandy. We got a revolution going on, and I am so disappointed in men. The women are doing all this crap. And we became American citizens. I'm going to become a woman. I'm not going to miss out this revolution. I'm defecting from the men's side. They are useless, okay? So there's your statement from me on these men husbands that are silly. Thank you.
Thank you, Bob. I'm sure Sandy appreciates that.
He did eat some of those.
Sandy. Sandy, I had someone make the oatmeal raisin cookies. Oh, gosh, I shouldn't say this on the air because I ate them all and didn't give any to Bob, but they were delicious.
Well, this next batch that I make, I know that how busy you are. I'll send it off to Jenny and have her send it to you. We'll do that one. We'll do it again with this next batch. This next batch is, it's going to be a different type of. Should I drop the ball? It's going to be a different type of chocolate chip cookie, based more on nuts and the added dried fruit, and so. I'm almost at perfection with it, just about there. And boy, is it going to! I'm so excited.
Okay, when you mail it to us, Sandy, put the name Bob on it. Not put Carolyn on it, put Bob on it, so I can get one.
I can get one. Oh,
you got it. In care of Bob. In care of pour over the
That's
Bob.
Right. X-mail.
Yeah, just for listeners, Sandy is making, Total Body Reset cookies and products. She puts Restructure in and the Remag and I don't know what else, but... that's
why I had to ask the question, because now I'm starting, my mind's expanding to other things. Well, why do I have to stick with just cookies? Why couldn't I do this? And so that's why I had to ask you, what did you think about... I was listening to the show. Plus, I wanted to say that lady could flavor up the stuff just to get it into her husband's mouth. Isn't that funny? You're right. Women are far more likely to do something for their good of their body, even if it doesn't taste good, where men are much more likely wanting to. I don't know, come to think about it, the young girls today seem to know their mind too, don't they? I guess it's just a universal thing. Everybody's out for the flavor. So, just keep drinking it. I'm telling you, you don't even taste it. Oh, that also reminds me. Can you freeze it?
Sure. Mm-hmm. That's no problem.
You can freeze it, but it doesn't freeze.
Oh, so it doesn't freeze solid.
Yeah, it doesn't freeze solid. It's kind of like it's not a slush. It gets a little harder than that, but it doesn't get like an ice cube frozen.
But in a recipe, you could freeze it, and I wonder if it would affect the recipe then, since that part of the recipe wouldn't freeze.
Well, I wonder
in the cookies she made, like I make a half a batch and then I freeze half a batch. Otherwise, they get eaten immediately. Mm-hmm. So in that sense, but if you were just going to take a big bottle of Remag and try to freeze it, it won't freeze.
Oh, no, that's not at all what I was thinking. What I was thinking is, could you make ice cubes out of it?
No, it won't freeze.
What about ice cubes?
Because it would be in water. I mean, I'm talking about the Remag water.
I see. Like you would make, yeah. Oh, that's a good idea. That's kind of cool. I don't know. We'll have to try it.
I'm talking about it, and it's mixed in the bottle of water. Could you take that bottle of water, put it in your ice cube tray, and make Remag ice cubes? That would be another way that you could slowly be adding, magnesium to your husband's diet, and not even having to tell him he's drinking the magnesium. It's just in the ice cube. It's just something.
Look at that mind at work. It's a pleasure. It's a pleasure.
But could you not take it a little further and take, say, some really good? Maybe you make a little slushy or something out of fruit, and then you add it to that. Then put it in the freezer and let it get frozen, and make like a frozen slushy dessert. Wouldn't that work?
Yeah, that would work. Right.
Yep.
See, you guys got me doing too good. The Remag has now calmed down my brain so much I don't even have the anxieties anymore, and my mind is now going on things of interest. And this is, and I'm coming up with all. You should hear me. I drive my husband out of his mind.
Out of his mind. Okay, Sandy, we're going to move on.
Hey, you have a great one.
Calls. Thank you.
Okay, have a great one, and thank you for speaking to me.
Anytime, Sandy. Thank you. Bye-bye.
Bye-bye.
All right, excellent, very good. Okay, Dr. Dean, we have to answer some mailbag questions, yes?
We don't have much. If you have more phone calls, but if not,
Okay, very good.
Get to the...
I'm going to read some of the questions off the chat line then, and we do have 602-666-6027. If you're going to call in soon. We've got about 13 minutes to the top of the hour, and then we're going to be wrapping up the show tonight. Carol Rosen typed in Carolyn and said that she is feeling much better. She said, when does the archive of the show get posted for those of us who came in late? Because this is working. The fact is, I think this Remite got me energized, and suddenly I found myself cleaning out my office. I've been threatening to do that for months. So she's doing great, and we're also going to post a link to your interview with her last Friday night, which is also on our Facebook page. I'll throw it up here on the chat line before the end of the show. The questions, hi, Dr. Dean, what would be the difference in magnesium therapy for AFib versus SVT, or is there any difference? My husband was diagnosed with AFib from one doctor and SVT from another.
The same protocol. I'm noticing. I have an AFib testimonial, I think, I have an SVT testimonial in the AFib book because so many people ask. But it's kind of the same triggers, the same treatment. So just read the AFib book and follow the protocol.
And if you want to download the AFib book, just go to blog.rnareset.com, and you'll see across the top where it says books. You just go to that page, and all Dr. Dean's books are there for free. Well, her e-books that she's written specifically for products and for customer education, they're all right there, and you can download that for free. Also, if you can't find your way through that, just email support, SUPPORT, at rnareset.com, and we will be happy to send it to you, no problem. Okay, let's see. Dean. We've answered some of these issues about palatability. Hi, Dr. Dean and Ginny. I'm going through some, and I was reading it the wrong way. I'm going through some kind of health crisis which started in November. From what I'm reading, I believe it's adrenal fatigue. I'm eating cleaner, and I have cut out the caffeine. I'm feeling a bit better, and I've tried to add Remag. However, I must be very sensitive since it's making me have extra bowel movements. After these bowel movements, I feel exhausted and dizzy. What's going on with me? I'm already slightly underweight and can't afford to lose any more weight.
Well, it sounds like my sensitivity, although Remag doesn't cause that problem with me. That's where we can send you the FAQ on how to bulk up your stools with the psyllium, for example, to keep your bowels from just reacting, being triggered. We say it's kind of like a detox reaction for some people. Difficult to say, but make sure you start out on your water intake with a quarter teaspoon of sea salt. Sodium is very important for the adrenal glands. We don't know exactly what's going on, but just read as much of my information as you can. Maybe adding the Remite first. I don't think we've ever done that, but what you could do is maybe start off with some Epsom salts baths and see if that is a safer way. If that's the case, then do Remag transdermally, just spray it on your skin so that it doesn't go through the intestines at all. So there's ways of kind of fine-tuning what's going on. You can call customer service. They will, reinforce what I said and give you support for doing it a different way, in a way that'll work.
Okay, excellent. Susan in Spartanburg, South Carolina typed in, I have a question about vitamin D and magnesium. Does vitamin D, even in large amounts, affect the magnesium, I mean by depleting it?
Yes, I've written about that in my Remag book for sure, probably in the Remite Recalcia book. Vitamin D, in order to change it from the supplement form to the active form, requires magnesium. So it'll pull magnesium out of whatever else it's doing to deal with this vitamin D. So the higher amounts of vitamin D you take, the more magnesium is pulled away from essential functions. And we've had a lot of reports of people who've been put on high-dose vitamin D, and then they really get thrown into severe magnesium deficiency symptoms.
Very good. Excellent. Alex from Chicago. I can't make the show tonight. I'm on the complement formulas as prescribed. I have atrial fibrillation with a small leaky valve and sleep apnea. I'm on metoprolol, 50 milligrams, warfarin 5, and diltiazem. Jeez.
Diltiazem.
240 milligrams daily. My question is, well, I'm waiting for my AFib and my sleep apnea to go away. They want to schedule cardioversion in the future for me after a small blood clot dissolves. Will this procedure be okay, and will it help in addition to my complement formula regimen? I'm on all the products.
Well, a cardioversion is mainly electroshock, like you see them with the paddles in the TV shows. Some people say the minerals, the Remag especially, will convert the electrophysiology in the heart, but I don't know your case. I guess what you have to do is maybe as the days go on, the weeks go on, see if your AFib is improving, if you get symptoms from it, or if you take your pulse, if you find your pulse is slower, then you'll know if the formulas are helping. Only you can decide whether or not you'll go for the cardioversion. Person doesn't have to be cardioverted if they convert on their own. I don't know what more to say about that. I guess you'd look up side effects of cardioversion and see what that entails.
Okay, very good. All right, excellent. Okay, I think we are caught up on my end.
Oh, good. And, okay, I have a question about uric acid and gout, so I thought that might be good to go over. The reader says, I think you mentioned that exercise helps reduce uric acid. Did I get that right? And that is true. I'm wondering if you know if higher uric acid might lower magnesium levels. And she or he says, I ask this because it seems when I eat foods that are higher in purines, which they'll lead to higher uric acid, that within a few hours to a day or so I get the same type of symptoms I feel when I have low magnesium levels. I'm currently on Remite. I love Remag. Getting ready to order Realign and RNA drops and Recalcia. So then, yes, it's a woman writing. So gout is relatively common. Comes from the metabolism of purines, and they're high in meat products. They say uric acid is a disease of the rich because in history, people who could afford meat were rich. So the metabolism of a purine food goes through several steps and becomes uric acid. The last two steps are catalyzed by the enzyme xanthine oxidase, which means if you have too much xanthine oxidase working, you make more uric acid. And the treatment is a drug called allopurinol, which blocks xanthine oxidase. So I was looking into this, and I did find only one study talked about xanthine oxidase being inhibited by magnesium lithospermate from salvia, a herb. So I don't know anything about this magnesium lithospermate, but it, sort of piqued my interest because, I've been saying over and over again the 700, 800 enzyme systems. Well, there's an enzyme, xanthine oxidase. Is it affected by magnesium? And this small study said that xanthine oxidase is inhibited by this form of magnesium. So I think the way you look at uric acid and gout, it's a lot of inflammation. There are crystals. I tend to think with anything that precipitates as crystals, there's probably calcium involved. I would definitely want people with uric acid or gout to be using REMAG as well as being on a low purine diet. So I'd like people to report in if they have noticed any shift in their gout symptoms being on the REMAG. So that's uric acid. And we're up to the hour, and I thank you very much, Ginny, for another lively and informative show.
Oh, yes, you're so welcome. Yeah, it was a great show. I'm so glad we went over everything, and everybody's doing so well on the formulas. Carolyn, thank you again for everything that you do. I know, technically you should probably be retired by now. And you're just getting started, so thank you again so much. Yeah.
Hey, Ginny.
Good night,
Bob.
I'm
calling you immediately after the show, Ginny. I'm calling you immediately after the show to review the show. I'm going to review the show in a minute. I'm calling you.
All right, Bob. All right, very good.
Thank you very
Good night,
much.
everybody.
Thank you, Bill.
Thank you, Dr.
Bob.
Dean.
Thank you.
Thank you, all the clients, needy people who called in.
AchieveRadio.com.
Well, it's marvelous, you see, as coming into your knowingness of the power that you actually have. As human beings, you can be, do, or have anything. And if you can get humans to come to the spark that activates the non-physical part that's already within them, they know. Then they know. Then it takes all the mysterion out of it. And then you can come into your power, your powerness, and you get down to the only thing that has ever worked ever in the universe is to come into an alignment, to relax and allow, and come into your knowingness to take your power